And also now I use usually the heavy cleans to clean the area.
Can you turn on the mic for? Okay.
Okay, can you put some more gauze in here? Can you wipe the other side first to me? Just put some gauze and wipe the other side. You okay, Kelly?
Mm-hmm.
Can you also go around the lips? So now, Katie, can you have a look at the mirror?
Mm-hmm.
So the area we're gonna work is the under cheek area, which is this area, to help to pull. Can you come forward, please? Okay. Alright, can you come, Juliet, this side? It's stay here as well.
Mm-hmm.
Very good. So we make a tiny hole with the 18 gauge in almost in this area.
Gauge?
Yes, after numbing. So I'm just drawing now. As you can see, we have some extra skin in here. Does everybody see? Basically, we are going to do almost the whole neck, under cheek, and the jowls for this lady. Maybe you come this side. Julia. We usually do not pass the fiber optic from this. So this is where your important arteries.
Because the already was there.
Exactly, yeah. So one tiny hole in here, we go this direction. Then again, another tiny hole probably in this area. And then we do the neck. So as you can see, this is the tragus of the ear. So about 1 inch before or in front, you make a tiny hole in here, and then also you go just at the angle of the mandible. You're just gonna make another hole in here to go this direction with your fiber optic. But first I'm gonna numb this area. How I'm gonna numb? I'm gonna use the lidocaine plus epinephrine plus bicap. So basically I use the tumescent. So however you usually make your tumescent, this is the way I do it. I don't put too much of the numbing because we're not doing liposuction, just a little bit. For two reasons. One is that the patient gonna feel more comfortable when we numb. And secondly, it's gonna separate the skin from underlying tissue. So then I can send the fiber optic easier under the skin. Because if you do not separate, sometimes the fiber optic gonna bend or curve and it doesn't go straight. So for these two reasons, I use the tumescent. All right, we're gonna do the numbing part. So now, Kelly, you can lie back and relax. Do we have the 22 gauge and also a Botox on?
Here.
So I'll use a 22 gauge blunt tip cannula. The tip of it is blunt. A little bit of pinch. You okay?
Mm-hmm.
Okay, a little bit of pinch. It's just a lidocaine. Cyanide first. Also, maybe very strong lady. That's why it burns really bad here. You okay?
Mm-hmm.
Alright, can you make that ready? So 2 ml of the xylocaine, about 7 ml of this, or 6 ml of this, 2 ml of that, 1 cap. So 2, then the rest 2%. So I don't know. Can you stop recording?